Hello, hello guys. Hi. Uh, can you can you please comment if I'm audible? Okay. Okay. So good number of people have joined. So I think this is the first time I'm coming live for this year's INICET NEET PG. So our preparation started almost in the month of August. That was the first video that I released in August of 2025. That was the first NEET PG strategy video. Followed by then I had released a series of videos. As compared to last year's NEET PG, you might have noticed that I was not able to upload many videos this year. Like the frequency of videos that I uploaded was actually less because because of hectic residency, I can say. Not much hectic, but still I had to balance my studies and residency also. Okay. So, but I was constant in mentorship sessions. If you had seen in YouTube live mentorship, I used to conduct 3 to 4 sessions every month. And also you would have studied a lot from Juxtamed quizzes. I had seen a lot of participation from Juxtamed quizzes in the month of January, February, March. So in these 3 months, we had a good amount of preparation phase also. So just before INICET and NEET PG, I had got so many queries on Telegram and Instagram and also on my email asking various doubts. So for some of the queries, I was not able to respond. So I thought it would be better to come online just before the exams so that if you have any doubts in your mind, I could actually resolve those doubts. And hopefully this session will be very helpful to those people who are lost right now, because when the exams come near, it is very difficult from students point of view to know what is important and what is not, what to study, and you will just lose track of things you had done. All the hard work what you have done in the last 5 to 6 months will all be in vain if you are not oriented towards last few days of your preparation. So we know that INICET is on May 17th and today is May 4th. So you hardly have around 11 days, okay, 11 to 12 days. So in this 11 to 12 days, what you need to know is you should be oriented, okay. First thing is you should be oriented to the exam, because most of them will be so much disoriented, so much you will be not knowing what to how to proceed, okay, in this last 10 days. That is the most important criteria for that decides your rank in the upcoming exams, okay. So first thing is you should know what you're going to do and what you need to figure out in the last 10 days, okay. It's not like you blindly go ahead. So last 10 days are mainly meant for revising important things, memorizing things, okay. You know that INICET last 10 days are mainly because INICET pattern is mainly based on PYTs, previous year questions and previous year topics. Every year it is the same. Either very new questions are asked which are very tough, or the same questions get repeated again and again. These are the only two patterns that are observed in INICET. So you should be very thorough in what you study. So for those people who have not made any timetable, who have not followed any revision schedule or anything, and you have no idea regarding how to proceed, the best thing to go ahead with is the explanation of previous year questions of last 5 INICET. So now you would ask me, how is it possible to go through all PYQs of INICET? It is not possible because you have limited amount of time. So what you can do is you don't have to go through each and every question. You don't have to solve questions. You have to go through explanation part of those questions, okay? That can be a game changer for you because you'll remember exactly those question explanations, whichever is asked in exam, okay? So in these last 10 days, GT I would not recommend, because whatever GTs you have solved, you would have solved earlier only. So the last 10 days, no GTs. Last 10 days are mainly meant for those very high yield topics which keep on getting repeated in exams, and you have tendency to forget those things, okay. So if you have not made any revision strategy, you have not made any revision plan, the best thing to go ahead is to go through those explanation part of recent INICET questions starting from 2020 till 2024. Whichever INICET, this new pattern INICET has come from 2020 November. Okay, so from since then, whichever questions are there, those explanation parts, okay, especially the pearls question, okay, pearls part, those tables, those you need to go ahead. Revising notes would have done already, so again revising note doesn't make any much of sense. If you have really concise notes which you can read in last 10 days, then go ahead. But again, you can come back to your notes and revise them if you feel that there is any difficulty in reading those like explanations. Okay, so what I feel for INICET is for NEET PG, the strategy is entirely different. Okay, because PYTs don't usually recur, so your strategy will be slightly different. But for INICET, for last 10 days, this is the best strategy if you don't have any revision plan. If you already have revision plan, if you already made in your concise notes, if you have figured out everything you have planned, then go ahead with that plan. Okay, so no worries. Second thing is you should be in that exam mindset, like whenever your shift in exam is morning. Okay, so you should be in that exam mindset, and you should be the most important thing is the prior exam night prior to the exam. Okay, so you need to take proper rest. What I believe is not studying the day prior to exam is still fine rather than studying late night or not getting sleep. Okay, so definitely you will be anxious because this is going to be one of the game changing exams of your life. So definitely there will be so much stress, you won't be able to sleep. I can understand that, even I also passed through the same phase. But if you are in a sound mind, at least 6 hours of sleep, 6 to 7 hours, if you're in the sound mind, there is probability that you will answer questions better compared to if you lose sleep. Okay, because I have many students who come to me with the same complaint that night previous to the exam they couldn't sleep properly, they couldn't get rest, and that's why in the exam they couldn't perform well. Okay, so these are small things that you need to consider. Okay, rest of things, I know you have prepared well from last few months, so there is no doubt you'll definitely crack. So now on, it's all about how well you are you are orienting yourself. Okay, how well you are going to face the exam. It is all about positivity. Okay, it is all about your state of mind. Okay, so it's all mind game from now on. It is not about your discipline or anything. Okay, it is all about mind game. So you need to be as cool and as chill as possible in this last 10 days. So with this brief introduction, let's go to the chat. Okay, so I'll be going through from the beginning. Okay, so I'll be not answering questions, repeating questions again and again. Okay, because those genuine queries will be left out. So I'll just be going through those important questions which will be useful to you. Okay, so there's a question from Med asking, I'm in 4th year, how should I prepare for NEET PG? Okay, so 4th year, right now the syllabus has changed. You know that okay, so you know that in 4th year, like there are all clinical subjects, and you have, like in 3rd year you have other preclinical subjects and all. Okay, so you have 4th year, which is of 1.5 years also. So that's why you have lengthy time, and in this time mainly you should focus on clinical subjects only. That is what I need to say, because all pre-paraclinical subjects you can again focus during internship, but mainly focus on clinical subjects now. Try to finish your syllabus within that time, but I would prefer this question to not answer in depth, because right now we are concerned about upcoming INICET, so we'll see later on. Okay, if I get time I'll explain that. So Garge asks, sir, how to improve from 100 correct in 1 month? Okay, so if you're already at 100 correct, that means you have already gone through all important questions, all important PYQs, PYTs. Okay, so a thorough revision of the same PYTs can increase your like score up to 120. Okay, above 120 you need to go through all important pearls. One is that thing. Second is you need to go through GTs. Okay, repeatedly giving GTs will get you an idea which is important and which is not. And finally, if you want to go above 150, then definitely notes. Okay, there's nothing other than notes. But again, up to 150, you can go through important things like important pearls, all GTs, if you review GTs properly. Okay, so all these things will give you up to 150. Okay, so there are two schools of thought here. One is that you will be building up from base. Okay, like you will be keeping a concise source, and upon that you will be building something. And second is you will be going through the entire notes, and then you will be cutting down things as and when required. Okay, So what I believe is building from base is more beneficial than cutting down things, because not everyone has that high IQ or ability to remember things. Okay, so my approach was again building from basics and adding on to whatever I have studied. So that actually suited me. Okay, so if you're doing so already 100 means your basics are sure. Now what you need to do is whenever you're giving GTs, okay, or whenever you're reading something new, just add on to your notes or add on to your revision source, whatever you have, and go through important pearls. Because what I feel is in this last 1 month, the one thing which can give you more output in return is if you have finished PYQs, then the second thing that you can give more output in return is the pearls. Okay, pearls or treasures. These are concise information, and solving those questions also will give you more benefit because you will have practice of those questions also. Okay, so these things, two things you can do. Akansha is not able to revise anything, getting burnt out and wasting the entire day. Okay, so follow the simple strategy that I told you. Go through explanation of all PYQ. Start from one subject, start from most important subject and go to least important subject. Okay, this is one strategy which if you don't have any strategy getting burned out, just go through explanation part. Don't solve question, just go through explanation part. If you feel that you are not thorough with something, then you can go through your notes for that topic only. Okay, because reading notes passively is a very daunting task. Unless you are very disciplined, you won't be able to finish it. Dr. Bullet has asked how to revise in last 3 days. Last 3 days in one day, I think you will go in your travel only, travel to exam center and arranging things. I don't think much will be needed. Okay, last 2 days, like one day for traveling and etc., and one day you can revise those important things which you are going to find. Definitely I know by this time you would have made one important notes or something of something which you will revise for last 1 or 2 days. Okay, some things will be there, like for example uh, things which you are going to definitely forget, or the mnemonics that you made. Okay, or the list of things which you had got wrong in GTs. Okay, these are the things which you need to revise in this last 3 days. Let's estimate as sir, please give revision schedule for NEET PJ. I would like to give revision schedule, but since there is severe shortage of time for me, so this year I'm not able to do revision schedule. Okay, so for this INICET, I'm definitely not able to do NEET PG last 10 days. I'll try my best. You would have noticed that my frequency of uploading videos has also decreased because I have my MD exams in next like 3 to 4 months. So I'm also not able to focus totally on YouTube. Okay, for your study schedules. You would have noticed that till last few months I was very proactively involved, but now I am not much involved because of upcoming exams for me. So that's why if you really want a revision schedule, I was going through few videos and I found Dr. Rishabh Jain had recently, yesterday, he had uploaded a video on uh, last 10 days for INICET. Okay, that is an excellent video. You can go through that. Okay, I really like the way he had segregated topics and mentioned it. Okay, so you can go through that video if you're not prepared in a revision schedule. If you don't find that useful, then you can go through the things that I mentioned just now. Okay, just go through important PYQs and PYTs explanation part. Malwa has asked how to qualify in first round if starting now, been a 7-year gap post MBBS. I didn't get your question. I didn't understand what you mean by first round. Anshuli has asked, sir, I'm getting 145 correct in GTs and score is stuck. How to break this plateau? Nothing. Now you don't need to worry about GTs. Whatever it is, go ahead. Because in last 1 month, if you think about you're stuck in GTs, your score is not improving, that is not going to matter. Okay, because you will be in that psychological pitfall only. Okay, so this in the last 1 month. Okay, till then you have scope to improve. Okay, in last month this GT yeah, like increasing your GT scores will act as a psychological trap. Okay, it's like you will be like, my GT score is not improving, so that will cause depression. Okay, that will cause anxiety. In that anxiety you won't be able to study. When you're not studying, definitely your GT scores will decrease. Okay, so this is like a trap, so don't fall for this trap in last 1 month. Till that it is fun because you have time to improve, but after that you don't have time to improve. So just focus on revising things, because revising things will give you better score than thinking about GTs. Okay, so now your main focus is on exam. Okay, 145 correct is really a good GT score. Okay, if you're giving like marrow GTs, it's a really good score. You can expect up to 160 165 correct in your main exams if you proceed with revision phase properly. Okay, so Eagle Eyes as us, sir, is it wise I don't know what everyone around me is doing BTR now. See, just because someone else is doing one source doesn't mean you will have to follow that source. Okay, maybe the source is suitable for that person, but for you we don't know yet. Okay, the best source for revision is whatever you had read earlier. If it was main notes, if you had concise, that is the best source. Okay, don't go for any new source in this last 10 days, not at all. If you feel still that you are not able to read your note, just go through PYQ, PYT's explanation for INICET. That is the best source, because there is the highest probability of something being asked in exam is from PYTs only. There's nothing else. Okay. So Atifa Azhar sir, can you tell us tricks to stay concentrated throughout the day without getting burnt out? Okay, one thing which I always talk about and which I have used successfully is Pomodoro technique. Very useful. Okay. See, when you're planning your day, you should plan in this manner. Okay, this is what I would suggest. Okay, maybe slightly different for you. So first thing is like you wake up not very early in the morning, because very waking up very early in the morning will make you sleep as soon as you like by 7 or 8 o'clock. If you wake up at 5 o'clock, by 7 or 8 you will be asleep again. Okay, for 1 hour some break or something. Okay, so ideally it's around 6:30. So that's between 7 to 8:30. That is before your breakfast. You get 1 and 1.5 hour time. Okay, this is the most crucial for studying topics that you want to remember, because at this point brain is at 100% capacity. It is fresh. You have just woke up. So to remember topics which you are going to forget, like for example biochemistry, pharmacology. Okay, topics like yeah, these two topics. Okay, biochemistry, pharmacology, or formula, or you are remembering microbiology. Okay, so for these topics early morning time is the best time. After that, you'll have breakfast for around half an hour, maybe 8:30 to 9:30. Then this stretch from 9 to 1 o'clock is second best time to study. Okay, so during this time, we'll be focusing on rest of the subjects. If you want to do custom modules, you want to prepare for exam like 3 hours, this is the best time, because this will simulate exactly your exam day. Okay. So in this you'll have to give gap. Okay, whenever you're studying, study for like 40 minutes and then 5 minutes gap. Okay, that is what I would recommend, because 40 minutes concentration everyone will have. Okay, so 40 plus 5. Then after second this one 40 plus 5, you will be taking some around 10-15 minutes gap. So you will have 3 to 4 sessions like this up to 1 or 1:30. I know it is not possible to like continuously focus like a mission, but if you keep your distractions away from you, like if you take your mobile away from you, if you sit quietly in a room or anywhere outside, okay, if you don't have any distraction, then this technique will definitely work. Then have lunch for around half an hour or 1 hour, and post lunch it is best to solve questions, or you can go through PYQs, or you can solve custom modules. But in last 10 days I won't recommend custom modules, because custom modules, if you're preparing for NEET PG, then this will matter to you. Okay, then after this you will be going through you can have a short nap in the afternoon, like 3 to 4, and then after that at 4:30 you start again. You will be fresh again. You can start with topics which are confusing for you. Okay, and then till like 7 or 7:30, then you can have your dinner, and then last 2 hours you can dedicate to topics like reading through PYQs explanation, or going through your 20th notebook, whichever mistakes you had committed, or going through image based questions. Okay, or solving problem questions. Okay, so these are the things you can do. This is what a typical day in last 10 days looks like. Okay, around 10 to 12 hours of study per day. Even in the last 1 month for your NEET PG also, the same schedule will apply. Okay, so next question, Rangaryaja sir, first revision not completed. You still have 1 month of time for NEET PG. Complete your first revision. Okay. Yes, Raja, approximate number of correct for top 500 in INI. Okay, see, if you want to be in a safer zone for a moderately difficult exam, okay, this is based on difficulty level, more than 160 correct is required. For top 500 at least will okay, top 500, okay, for top 100 more than 160. Okay, for top 500 at least more than 150. Okay, for a moderately difficult exam. It is if it is a difficult exam, then more than 145 you can keep it. Okay, so if you want to qualify, then that you can't equate GT scores to your INICET and NEET PG scores. Okay, because in GT you'll be competing with first of all you'll be competing with maximum how many, maybe 50,000, maybe sometimes 1 lakh students, not more than that. But in NEET PG, you will be competing with some around 1.5, 1.8 or 2 lakh students. Okay, that is one thing. Second thing, GT will be giving comfortably in your home. Okay, you will be like either half prepared or you will be fully prepared for it. You will have everything under your control. But in exam, that stress will be totally different. So even those who are performing well in GT may not perform well in the exam. Okay, and if you're cool-headed, if you're very relaxed, then you might perform better in your exam than in your GT. So you can't correlate those things. Okay. So Harlan asks, sir, which is better, giving retrograde with PYQs and GTs or revising notes? For NEET PG, if you have 1 month left, then retrograde with PYQs is a good approach. Revising notes, I would still keep it one because always your active revision will actually matter. Okay. So even for this last 10 days of INICET, if your notes are well made, if it is revision type of notes and you can finish it within last 10 days, you have made it concise and this is your third read, then go ahead with revising notes. If not, then just go through explanation part of PYQs. But for NEET PG, if you go with retrograde with PYQs, that will be better than revising notes. This is what I believe. Okay, because revising notes only is like going passively. You will absorb some things and you will leave some things. But when you do active revision, you will have better retention. Dr. Shruti has asked how to beat burnout. I have already explained this few minutes ago. Dilip says, sir, I'm stuck at 1 is to 110, 100 to 110. Sir, I need to get at least 150. Is it possible? There is 1 month left. That is a question you need to ask yourself. How much? That depends totally on how much is your ability first. If you have good ability with good foundation of your MBBS subject, definitely you can go up to 150. Second is how much hard work you are going to put in this last 1 month. And third is how good you are at on the day of exam. Okay, these three things decide. It's not unlikely, but the probability is very less. Okay. Akansha says, sir, also please tell about NEET PG plan. So only so that we can plan accordingly in short. Okay. So for NEET PG, let's say approximately you have 1 month and 10 days from now. Okay. So that is the time you have. So in this 1 month and 10 days, you'll be going through one revision entirely. Okay. And in this last 10 days, you'll be going through the second revision. Okay. So in this last 1 month, what all to prepare? Say in this 10 days, you'll be preparing for INICET. But if you're very focused towards NEET and you're just giving INICET for practice, then just give it as a practice only. Okay. So you don't have to prepare specifically for INICET. But one thing that you can do is you can go through explanation part of INICET PYQ, because that can again repeat in NEET PG. As you saw in last year exam, INI PYQs were repeated in NEET PG. So that is one thing that you can do. Second is, if you do that approach, then you will be losing around 10 days and you will be left with 30 days only. Okay. In those 30 days, you'll be giving 20 plus 20, 10. Okay. Which will be less. So if you have not done your first revision properly, I would recommend you give 30 days for NEET PG revision and last 10 days for NEET PG final revision. Okay. So in this last 30 days, that is your second revision. I hope first revision you have already done by now. For your second revision, that is in this last 30 days, you will be focusing on topics in my last video that I had released. I had told you how to prepare a timetable. Okay, so if you have no idea regarding how to prepare timetable, you can just enter it in ChatGPT. I had also told you how to give prompts, like what to type in ChatGPT exactly, so that it will make you a schedule and give. Okay, so it will give a very good schedule. It will think according like a logical thinking. It will think and it will give you. Okay. So I think that will be useful for you. If you have not done, then you can prepare a revision strategy. Like earlier I used to give revision strategy, which was actually helpful for students, but I don't think this time I would be able to give. If possible, I'll try to upload a video for NEET PG last 1 month revision strategy. Okay, but I'm not sure about this. So that 30 days plus last 10 days of NEET PG strategy, what to study, that also important things I'll let you know. Okay, I'll try to release a video on that. So Malwa asks, how to qualify in round 1 NEET PG this year? How to qualify is you get marks, that is the rank above that percentile. So it's straightforward. Dilip says, sir, I am stuck. I have already answered this. Ashwin Sharma says, sir, please guide for final year students. So final year students, your main objective is to finish final year subjects, because earlier it was like ENT, Ophthalm and all were in third year. So you would study that in third year. But now what has happened is everything has come to final year. So your main target is cover that in final year. Cover all clinical subjects in final year. Okay. Your main target is only that. because when you see NEET PG exam, they will be like very much focused towards clinical things only. So unless you finish clinical things, you won't be able to get a good hand. Okay, you can use video lectures or various coaching app. They're really good, and they will be helpful for your university exams also. Even for in my case also, my final year was predominantly based on Marrow. I used Marrow, so it was based on Marrow videos only, and I was able to perform well in my very well in my MBBS exams. Okay, university exams. So you can use the same source for university exam, but try to finish all like video lectures if possible. Okay, because that will be a very good base for you. Okay, foundation for you, and start giving GTs. That is what I would recommend. When you give GTs, then only you will realize how much there is to complete. Okay, or else you will never know. Okay, so Ishrat asks, does the current GT score say that you will score around that only? I told this a few minutes ago. It doesn't. So your final NEET score doesn't depend on your GT score at all. Okay. So my GT NEET mock score, that was like I think 2 or 3 weeks before NEET PG, was 155 correct. Okay, but my actual NEET PG score was 161 correct. So if I had thought like, oh, my GT scores are not improving, I need to get above 170, 160, still it is not good. If I thought like that, and my rank was also in that, it was something 5,500 something. Okay, so I didn't think about much. Okay, so I thought if I don't think about it, if I don't fall into that psychological trap, then definitely I'll be performing well in my main exam. So that is what happened. Okay. So yes, as us, which are the top 10 subjects? If you watch my videos, you already know. Okay, the most high yielding 10 subjects. Okay, I had given that formula also. Okay, so just watch my videos. There's 10 important subjects that I've told for NEET PG. Okay, for INICET they are different, NEET PG they are different. Okay, that is P4 S4 BF formula that I had given. Okay, for NEET PG, that is pharmacology, uh, pediatrics, pathology, psychiatry, surgery, okay, skin, that is dermat, and biochemistry, forensic, and there are other two. Yes, I forgot. Okay, whichever other two yes are. These are the 10 important subjects for NEET PG, and INICET. There are top 6 subjects which are medicine, surgery, OPG, patho, pharmac, and anatomy. Okay, these are the 6 subjects for INICET. Sakshi, sir, how to balance theory and MCQ? Okay, should I do PYQ subject or custom module? So PYQ do subject wise. There is, because you shouldn't leave any PYQs. Okay, so PYQ do subject wise. Theory and MCQ do 30 to 70. If you're preparing for NEET PG, that's what I assume. 70% is theory and 30% is MCQ. Monty is the best video source for INI PYQ videos. Best source is recall sessions that are available free on YouTube platform. That is the best video source for INI PYQ videos. Aishwarya has asked, sir, is it needed to revise previous INICET GTs now? No, because you have only 10 days, don't go behind it. Instead, revise INICET PYQs of last 5 years. Sakshi asks, sir, how to cross 130 plateau? See, if you're targeting upcoming NEET PG, then don't worry about it. Okay, don't worry about GT right now. But if you're preparing later on, okay, like maybe for NEET PG 2026, then you can watch my video on GT, how to improve GT scores. Okay, there's one video which I released maybe 6 months back, and it has total detailed. I have given every detail impossible on like how to improve your GT scores if you're in plateau phase, how to come out of plateau phase. Okay, so you can refer to that. Raghav Chandra, sir, I started preparation 15 days back because of counseling. What is the best plan now? Last time I read BTR and my own notes, which was made 3 years back. So should I read those notes or see RR videos? Your best source right now is BTR only. Go ahead with BTR and your notes, use it as your this one, and along with that do PYQs. That is the best thing. Bhavya says, sir, stuck at 120, how to improve? Don't improve right now. Focus on revision. Now is not the time to improve on your GT scores. Surgeon as a, sir, will this video be uploaded? Yes, it will be uploaded. Okay, Malwa. Okay, so there are many questions below. Okay, Malwa, so just need to qualify in round one NEET PG. So go through PYQs, come above 120 correct answers. Rangar is asked, sir, for first revision, should we solve PYQs again or just give subject wise tests or T&Ds? If you've done your first revision, then you don't have to solve PYQs again. Okay, you can give subject wise. No, don't give subject wise test. Subject wise test has no value. Give GTs or give TNTs. Both are okay. GTs and TNTs both are okay, but don't give subject test. It has no value at all. Okay. So PYQs, if you have not done so far, then you definitely have to solve. If you've done already, then you don't need to solve. Okay. Himanshu sir, don't you think 5 session rule is really harsh on students? Yes, it is harsh. It is harsh. Okay, because uh, if it like when I had attempted, it was like 3 hour session. So we can take breaks and because in three, it's not like a sprint. Okay, NEET PG, like there are 180 questions. So you can't go through all the questions with utmost alertness. Okay, like 3 hours you can't focus. You are not a machine. But when it comes to this shifts, like these 5 sessions, it's like in every session you will have to focus thoroughly. Like you can't lose your focus because you have limited amount of time, and it is very hard. So unless you practice that, that's why I always tell do custom module, custom module. Okay, custom module is the key because they will be focusing. You will have that focus for 42 minutes. Okay, so ideally that is not good. Okay, like 5 sessions, but then nothing much is in our hands. Okay, your ordinary doctor as well. How many years INI and FMG PYQs are needed? 5 years of INICET since INICET has started. Okay, FMG I don't specifically recommend. Okay, NEET PG last 5 years if possible since 2020, because after that from 2021 pattern has changed. Okay, so from 2021 you can go if you have time, then you can go behind that also. Monster sir, make video on how to crack NEET PG in 40 days. See, I like making videos. Uh, I like to guide students. I like to hold more, conduct more live sessions. I like to interact. The problem is like I'm not free. Okay, so I'm in my residency, and during last year when I was in second year of my MD pediatrics, it was relatively chill, like because there was work obviously, but there was free time also. I could actually there was not much of studying and all. Okay, so I could actually spend time on YouTube. But right now I have my exams pending in coming up in next 3-4 months, so it's difficult for me to focus both on my academics and guide you also. So even with that also I'm trying to post at least one video per month. Okay, at least during for revision or something I'm trying to do, but I don't know how much it like how much time I can actually spend, because I think those people who had followed me from the beginning are finding that right now like I'm abandoning them. So I'm very sorry for that, because I have to focus on my academics also. Once this MD exams are done, and then I'm totally free. So I think the upcoming batch is going to be more they are going to be more lucky because I can guide them throughout. But this year I think I won't be able to, I was not of that much I couldn't focus much on making videos this year, especially in the last few months you would have noticed, because I'm also in my like slightly hectic part of residency. So I'll try to make video. Okay, I'll keep this in mind. I'll try to make. Okay, so Himanshu, sir, in last 1 month, do we revise whole syllabus or important topics? If you can revise the entire thing, if you have made a revision notes which you can, or a concise notes which you can revise in 1 month, go ahead with it. If you can't, then you study topics in order of priority. Okay, like priority number 1 to number 2. For example, when you're studying pediatrics, leave systemic, start with neonatology, start with infection, start with growth and development. Okay, start with immunization. So these are the most important topics. Even if you leave so like nephrology, pediatric nephro, or pediatric rheumat, or pediatric cardio, where 1 or 2 questions are asked, it is okay. Monty, sir, I gave INI mock today and got 148, which actually it is a good score. Okay, and got a very good score. Okay, Should I prepare for INI? Should I go for NEET? Definitely go for INI. Okay. Study, give like INI for this one. Okay. You have good chance. Okay. Give INI, study those important INI PYQs or important topics in these last 10 days, and then you prepare for NEET PG. Give both. My brothers are getting 160 plus in last year INICET GTs. How to go about in these 10 days? So 160 plus in last 10 days is a really good score. Okay, 160 plus. So last 10 days are mainly focused on studying those things, memory based things. Okay, memory based thing. I think you can go through pearls of important topics. That is what I would recommend. Or if you have made a revision notes, you can go ahead with that. If you're getting already 160 plus, that means your basics are also strong. You are ready your notes also. If you have very concise notes, you can go through your notes also. Okay, that is also fine. But if not, then last 10 days you have no idea like what to prepare, then just go through PYQ's explanation part, which you can complete very quickly because you already are expert in that. That will ensure that you won't make any silly mistakes. Second, you can go through extra pearls of the subjects if you have time. Okay, you would have bookmarked pearls, I'm sure. Yogita sir, is it possible for me to score 170 plus correctly stuck between 150 to 160? Yes, definitely. That depends on your state of mind on that day and this last 1 month of revision. Definitely you can score. Shelby sir, is NEET PG and INICET easier than Marrow GT? Depends. Like INICET of my that I gave was tougher than the Marrow GTs. Okay, it was way tougher. Even toppers also didn't score more than, I think there were less than 10 people who scored more than 160 something. So if exams are like that, then it is going to be very difficult. But typically from last 2 years, what we have observed, it is of moderate difficulty, slightly easier than Marrow GTs. Viscaza sir, should I do Marrow Q Bank? For what? Like for this upcoming NEET PG and this one, I don't recommend. If you're doing for the upcoming NEET PG 2026, yes, more than 50% of correctly answered questions and PYQs. These are the two things you need to do. Kirtira sir, for NEET OG. Okay, NEET sir, for NEET PG exam, should we go through INICET PYQ also? Better if you go. Last 4 years of INICET. Anyways, you will have to give INICET, so revise those. That will be very helpful. Dr. Emma, so why are you skipping my question like twice? Okay, let me go back. Dr. Em, I can't find any of your questions on my live chat. No, please mention your query. I think there was some glitch from your side or maybe from on the side of YouTube. I'm not getting any of your question. Okay, kindly type it again. Kirti sir, for NEET PG exam, should we go through INICET PYQ? I already answered this. So what do you expect the difficulty of NEET PG might be this year? I'm not preparing question paper. Shall we ask sir, minimum number of questions to be attempted? Okay, this is a good question. So ideally what I say is, if it is an easy exam, more than 195. If it's a tough exam, like you'll know by the time you solve 50 questions, then at least more than 185. Okay, INICET at least 185, more than 185. Leave only those questions which are memory based, numericals or fact based, which you have no idea about. Only leave those questions. Harshvardhan, should we do RR or LRR right now for INI? I don't know what LRR is. Okay. Atif Azhar sir, how much should I be scoring now in GTs to stand a chance in NEET PG? Nothing like that. There is nothing like about with this score you will be getting a J, because see, what you're not focusing right now is what you're not knowing right now is that your GT score and rank doesn't matter. Okay, what matters is your counseling, and counseling is totally different game. So even if you focus little bit right now, if you're on your track, if you know what you're preparing, and if you get even a decent score also, in counseling anything can happen. Okay, so your ultimate goal is not to get a NEET PG rank or NEET PG score or whatever. Okay, your ultimate goal is to get a seat. You're studying to get a seat. You're not getting studying to get a rank. You're basically studying so that you're in a negotiable position to get a seat of your choice. Okay, that is your aim. not NEET PG rank. Okay, so don't focus much on GT score. There's nothing like GT score this much, because even if you have a very bad GT score, and if you have a category and or quota, and if you have a very good luck, even in third round of counseling also you'll get a very good seat. So score NEET PG is just a I think NEET PG counseling is a bigger headache than NEET PG exam. Exam can be get done, but counseling is totally different game. Your ordinary. So what happens if the computer stops working in the exam? Do we get extra time, or we lose that particular slot completely? Okay, this is a good question. The probability of this happening is very less, but I think you'll get extra time. I'm not sure about this. Okay, I'm not sure about this. I think this is mentioned in NEET PG prospectus. Rangaja sir, all the best, sir. In the morning, I went back to your last year videos for schedules. Okay, good. Yeah, you can follow that also. That is also applicable right now. Last year, I released the last 1 week preparation strategy for INICET and NEET. You can go through that also. G and J as sir, GT score is not crossing 100. Please advise for NEET PG. Say, if you want to go above 100, say if it is not crossing above 100 means still your PYQs and PYTs are left. So go through PYQs and PYTs of NEET and INICET thoroughly. Okay, that is where you're losing. One thing. Second thing, you might have not finished some subjects, or you don't have finished important topics. At least go through important topics. How to know which are important topics? Watch my last 2 videos on last video which I released I think 2 months ago on how to proceed for NEET PG preparation. So in that I had given all subject important topics subject wise. Okay, so go through that. If you go through these two, definitely it will go above 100. Dr. Das unplugged. Sir, I'm an in-service candidate for NEET PG. I have had a break of around 2 years on studies. I want to get around 30 rank. Please give some realistic tips. Okay, realistic tips is for INICET, PYQs and PYTs are the most important. For NEET PG, PYQs of last 5 years must be done. There is no like other thing. Okay, because PYQs or PYTs for NEET PG are the gold standard. That is because these are the highest probability of getting repeated. Okay, you can't predict any other questions other than PYQs and PYTs. Okay, that is one thing. Second thing is, if you have studied at this point of time, then you can go through revision notes. Okay, revision which you can complete in next like 1 month and then revise. So these two sources I think will be good. And third thing is time management in exam. So you need to give at least 2 or 3 GTs. Rangari Azar sir, how are you getting 160? Please help me. Okay, I think this question was for someone else probably, or was it for me? Getting 160. See, my strategy was very different. Okay, I had hectic internship, and during internship I was not able to study for initial 6 months because I had medicine postings followed by minor postings, where for 1 month around I was able to study a little bit, and then I had very hectic surgery postings. And during my last 3 months also I had OBG and pediatrics, which are again hectic postings. Okay, so my strategy was simple, straightforward. One was focus on GTs. GTs told me that which by like 6 months before exams, GTs exactly told me where I'm lacking behind. Okay, so I thought I was like prepare something else. I was watching videos, that and this, and then GTs told me exactly where I'm lagging behind. Then I made this GT tracker. I tracked which subjects exactly I'm lagging behind. I noticed which subjects are like in my red zone. I realized which subjects are in green zone, and I need to focus less. So if you want to track your GTs, already GT tracker is there in my Telegram group. Okay, link will be there in YouTube channel description. So click on that GT tracker, you will know how to track GTs. Okay, so that was one thing. Second thing was I did all PYQs, PYTs as many as possible. I was not able to complete everything, but from GTs, when I was giving GTs, I could get through those like whichever things we had not solved. Third was GT partner, because we used to discuss things, so it was very easy for us to know which things we are getting wrong again and again. So it was very easy to track those questions. So I used to modify many questions and then go back. Mine was more of like an active recall type of method for my NEET PG preparation rather than going through notes. To be frank, I had not touched many notes, like medicine I didn't touch. Okay, surgery also I didn't touch many things. Biochemistry and all also I didn't touch many things, because most of the things which I studied was from active recall revision only, from PYQs, PYTs, from GTs. Okay, and I studied very less compared to what you guys are studying now, because I knew exactly where to study from. Okay, that I think was much useful from my part, and my MBBS knowledge was also fairly good. Only I had performed well in my MBBS first, second, and final year, so I thought that was almost okay for me. Okay, refer code as sir. Is it possible to jump from 145 to 160? Yes, you can. Dr. Quinteros are getting 140 to 150. How to improve for INICET? Right now is time for revision. Okay, so don't worry about GT score. Monty, some message is retracted. Okay, yes has asked, sir, I have done 16 subjects except half ortho, anesthesia, systemic pediatrics. If I only revise covered portion with damn specific plans for INICET mission INI plus INI PYQ plus emergency videos plus DVT, just giving INI 140 correct. See, first of all, just studying 16 subjects is not going to give you correct above 150. Never. Because you have ortho and pediatrics, which are very important topics. And third is anesthesia, which has also some important topics. And then you have to revise things also. So maybe you'll land up around 130 to 140 with whatever plan you have. And that too for INICET, it is 10 days are left. So it totally depends on you, but the possibility is very, very less. BTS RMD, so can we increase from 120 to 150 in these 40 days? Yes, you can. This you can. 110 to 150 is possible, but that is because once you start revising, things change. Things drastically change. But I shouldn't think you should focus. You can give 1 or 2 GTs maximum. Last 10 days, avoid GTs. Okay. But still 110 to 150 is possible actually if you have if you had done proper preparation phase and now in your revision phase, then you can. Okay, that is very much possible. Vivek has asked, sir, 15 days strategy. I don't know if I'm able to upload this video. Actually, sir, I'm now getting 120 correct. Is it possible? Yes. 150 plus, I don't know, but up to 140, 150 possible. Yes, see, sir, last year before May INI, you came up with great analysis. Can't find that video. No, it is there in the YouTube channel. Just find. I had not removed that video. It is there. Sushmant Azad, sir, I have completed first revision and my JT score was 110. And how to plan this 40 days? Okay, so basically you are asking is for a schedule for 40 days. Okay, guys, so there is a lot of demand for strategy for NEET PG. Okay, fine. I'll be uploading one video. Okay, I'll make a video. I'll try my best. I'll try to upload this video in this week. Okay, for last 1 month, probably after INICET. This one, you guys will be focusing on NEET PG. Based on that, I'll make a video. Okay, I'll make a video separately. Monty, sir, how to revise big subjects in one day? 1 subject per day is possible. Okay. Then again, say whenever you are in a query, this is generalized rule, like what to study in a big subject. Like let's say for example surgery, how to study surgery in one day. First of all, you would have had concise notes or revision notes. So main notes, it is not possible to revise. It is humanly impossible. So you should have made concise notes. If you have not made concise notes, then forget. That is not going to help. Just go through PYQs and PYTs. Only that you can finish in one day. If you've done your notes, maybe revised notes or concise notes, then how to finish, go topic wise. See, if you have like maybe let's say 300 pages to be finished in one day, in that 100 pages will be content from which 1 or 2 questions are asked from surgery, which is not at all important. Then rest there will be 200 pages which are very important. In that, try to segregate. Okay, topics like for example in surgery, thoracic-vascular is very important. Okay, topics like trauma is very, very important. So start with those important topics. First half of the day you will be dedicating to that 30% of the topics from which most number of questions are asked. How to know these important topics, I had already discussed in my previous videos. Just go back to the video that I had released 3 months back. I had released 2 parts, part 1 and part 2. Subject wise I had released, and I had told detailing which topics are important in which subject. Okay, also important topics are also uploaded in Telegram group. There are different files and they are pinned also. So go through those topics. Even if you leave some topics from surgery, it is fine. It is fine actually. Okay, so That should be your approach. You can't finish everything, it is humanly not possible. So prioritize. Okay, it is not about completion, it is about prioritization. Okay, it is not about perfection. Yeshua has asked, sir, if I start now, can I get 25? Okay, see, whoever asked me these questions, like, I'm starting now, so will I get this much rank within this many days? So my reply is totally like straightforward. Okay, there are only two options where you can perform very good in less number of days, and if you are starting today, one is you should have an IQ of more than 160. Okay, extremely brilliant IQ, and you are prepared brilliantly in your MBBS. Okay, you are an exceptional student. And second is you should have, for getting a seat. Okay, for getting a seat, you should either have a very good quota, reservation quota, or second is you should be involved in some form of corruption. Okay, only then you'll get a seat. Shelby is like, sir, scoring on the okay side, but only problem is due to exam sheet I'm not able to study with my full efficiency, but still trying to study somehow and to stick my routine. Yes, it is totally normal. If you're planning to study 100%, even if you're doing 70%, it is really good. BTS Armadas, the timer stops and you get extra time. It happened to me. Okay. I think you're telling about this NEET PG exam. What if computer stops? Like your computer stops. Okay, so the timer stops and you get extra time. Okay, it happened to me. Okay, fine. Okay, I'll remember this. Yes, as asked, sir. Oh my God, that computer question, new fear unlocked. Okay, I think this BTS army has unlocked. Okay, that's like answer to this. Okay, Dr. Manish has asked, sir, BTR plus PYQ sufficient? Sufficient for what? Cracking? You have any reservation quota or what? It depends totally on that. If your target is 120, then it is sufficient. 120, correct. Yes, he has asked. Okay, the timer stops and then resumes when computer starts functioning. Okay, fine. Dr. Quinter, sir, skipped my question twice. Okay, let me go back. So getting 140 to 150. Okay, how to improve for INICET? Question by Dr. Quintero. Okay, so you're already getting 140 to 150. There are two things here. Okay, one is you should focus on not losing that marks. Okay, what happens is you'll focus on new things and all, so definitely your marks on those questions which keep on repeating and this one will decrease. So that's why PYTs in last 10 days is mandatory, no doubt in that. Okay, second thing is like you need to improve more than that also, so you'll be going through questions. Mainly you'll be revising things. So I don't think anything extra is required right now. Mainly focus on your 20th notebook, the mistakes that you had committed in GT. That I think is a powerful thing that can give you extra marks. Okay? And those bookmark pearls, okay, star bookmark pearls, that will better help you to improve, okay, from whatever you have done so far. Okay, Swati has asked what to do in this last week. I have already discussed this. Yeshu has asked, okay, I had already answered this. To Quinter's question also I have answered. G and J, sir, for PYQ, is it enough to read explanation in Marrow Bank or should I study for PYT from notes? See, it totally depends on how much thorough you are in that topic. PYTs means any type of questions, if it is asked on that explanation, you should be able to answer. So if there is a question, for example, on porphyria, and your theory part is not strong and you don't know how to answer some twisted questions, for example, then you should definitely go back to your note, because porphyria, for example, is a repeated PYT. Okay, so in that case you should go back to your notes. Okay, otherwise you can just go through explanation. Shreyu says, sir, can you please plan a proper 10-day schedule? No, I cannot because of the time constraint that I have. So I had, in the initial part of the video, I had recommended Dr. Rishabh Jain's video, which I released yesterday on last 10 days schedule. It is really good. Okay, you can follow that. Shri Krishna, sir, approximately 100. I had already answered this. Okay. Now, like I had answered similar question. Please go back to the few minutes back. Navya says, sir, I'm getting around 125 to 130. I haven't prepared well at all these months along with new ones. You have to revise your strong subjects along with new ones also. Okay, there is nothing like that. Okay, I think 125 to 130 is because you are not preparing well. Okay, so definitely you have to finish off these important subjects. Half surgery definitely important, anatomy is important, at least the most important topics. Pediatrics half, you should complete those things and then go to revision. Okay. Strong subjects you can still hold on. श्री कृष्ण दास सर 100 अप्रॉक्सीमेट ए करेक्ट हो रहा है या उससे कम क्या करें? अगेन पी वाई क्यूज पी वाई टीज. यशु, इज इट पॉसिबल टू गेट? आई हैड ऑलरेडी आंसर्ड दिस. Sanjeev, is it necessary to complete whole medicine? No, not at all. Even if you leave medicine also, it's fine. Bilal, as a final year student, should I do custom model or nothing? You first just focus on finishing your MBBS and try to finish all your videos if possible. Okay, and start doing GTS. GTS is the one thing that you can do. Don't do custom module, not necessarily QBank also. Dr. Manish has asked, sir, BTR plus PYQ NEET PG 5-year plus INICET 3-year is sufficient. Yes, it is sufficient if you want to get a score up to 120. Above that, not helpful. Narang, people questioning as if he is an Australia. Yeah, rightly said. People are asking me all these things. Monty has asked, sir, I had a gap of 10 days due to some reason in my revision. Okay, today I gave INI mark. 148 is a really good score. Okay, I don't know why you are not confident. 148 is a really good score for INI. I am not confident about my revision for NEET PG. I am afraid that if I read for INI only in these 10 days, there will be less time for NEET PG after 17 May. What should I do? Go ahead with INI PYQs. At least that will help for your NEET PG also. It's not like INI PG and INI and NEET PG are very different. Okay, so both these are like almost same only. Okay, so you don't have to do them very separately. Just go through PYQs, which will help you in NEET PG also. Okay, so once you go through PYQs of INI, you will notice some questions which are specific to INI. You can skip that if you want to focus on NEET PG. Shankar, right now in 130, 140. So from I have already answered these type of questions. So please stop asking questions like you are getting GT score and of this much and this much. So how to improve? See, in this last 1 month, don't focus on your GT score. Okay, that is the main thing. Your GT score doesn't reflect your NEET PG score. Okay, till now it is fine because you need to improve. Okay, right after this it is psychological trap. So please don't ask like if you are getting this much and this. I'm not going to answer any other questions related on this because there are so many. Okay, SCRs are giving credit where it is due. If you are lost, you follow this man, especially for INI, which ends up being great confidence boost for NEET. I really didn't understand what you mean. Patrick says, sir, I'm not good with reading and PYQs. Okay, so can I expect to win top 100? I don't know. Shri Krishna, sir, NEET 2024 NEET PG, 2024 FM, these papers are drastically different from past NEET. उसे देखकर समझ नहीं आ रहा है कि प्रिपरेशन कैसे करें. पेपर लुक लाइक एलियन. So look at 2023. It is more like NEET PG previous year questions, and you don't know how 2025 paper will be. No one can predict. So what you can best do is you can trust on things which you know will recur again and again. Okay. Getting 145 to 150 correct. Would you recommend doing PYQs or going through notes once more for this time? If you have prepared concise note, go through notes. If not, then go through PYQs. Dr. Quinter was asked, thank you, sir, following you since NEET 2020. Huge fan of your logical. Thank you. Thank you. Bilal asked, sir, how to study final year to get selected in internship? Okay, I'll make a separate video on this. Okay. So 2 things I have noted down, which I have to make video. First, I'll make on NEET PG last 1 month strategy. Okay. Last 1 month and last 10 days also if possible. I try to include in that only. Second is for final years and for final years and this internship batch we are going to do. I'll make a separate video. Okay. So we have already passed 1 hour of this live session and there are so many questions also. So I'll only focus on important ones from now on. Nikita says, sir, how many previous year to cover for INI? Last 4 years from 2020 November onwards. Okay, this is a good question. How to approach SARPO? I think what you mean is like skin anesthesia, ortho, all those subjects, psychiatry, and I don't know what is R for, in last 10 days. Okay, so psychiatry, you need to focus on those 5 topics which are really important. Okay, if you solve PYQs, you'll know those. Okay, just solve PYQs for that. Ortho, there are few questions which I told already in my NEET PG previous video. Okay, like which are important. Okay, ortho only some 4 or 5 topics are important. Radio, don't focus. Anesthesia, there are three topics, three or four. One is neuromuscular blockade agents and anesthetic agents. Second is CPR, okay, and third is related to those airways, okay. Earlier questions used to ask, but now I don't think many questions are being asked. There's one or two more questions, okay, which I have already discussed in my previous. Go only through those things. Rangaja sir, for subjects like ophthalm and ENT, how to revise them? Did Marrow, RR and BT? That is enough. Revise that only if you have revised already. Yashoda sir, how to do PYQ after completing each topic, then do PYQ, or first do whole through, then do PYQ airways, or solve PYQ and read explanation only? So this is like a MCQ for me to choose. So ideal thing is do PYQ first, then go through subject, because then you will be knowing which are the important things. Prajnesh has asked, sir, how to combat PSM. PSM is simple. There are only 2 or 3 topics which are really useful. One is epidemiology, okay, those studies and all. Second is vaccines, very important. And third is biostats. Rest of the things we can answer anyways. Sushanga sir, not able to remember. Unless your IQ is more than 160, you won't be able to remember. It is common to all. Everyone doesn't remember. So that's why we have multiple revisions, and that's why we have some important questions. Why do you think NBMS and INICET question papers have PYQs? Is it because they don't have questions, new questions to prepare? No, they can prepare from any topic. They can't like PYTs are not at all important. PYQs are not at all important. They can make any question from anywhere. Every year they can give the same question. So what is the concept of same questions repeating again? There are two things, okay. One is, even they know that you can't study everything, so they focus on same things again and again. Second is the things that they focus again and again, either they are current research topics or they are more important clinically. So in day-to-day practice, when the examiners, those 50-60-year-old examiners, when they old people, when they start making this question, they'll be thinking of those topics which come again and again. For example, thalassemia always comes to their mind because they'll be seeing thalassemia patients in their life. If it's a pediatrician, they'll be always saying like if it's an AIMS professor who is sitting in his chamber and making question paper, he'll be always thinking of SMA questions, or he'll be thinking Duchenne muscular dystrophy, because research is going on that topic in AIMS. Okay, if it's a neonatology person who is doing this, or some HOD from neonatology, so he'll be always thinking about topics on neonatal jaundice. Okay, they'll be thinking of this scoring system, because that is the thing they are doing research upon. Okay, so common things they'll be giving question. These common things will repeat again no matter whoever the examiner is, because these are the common cases that you also see in your future practice. Okay, so common questions are going to be the PYQs. Second is frequent researches which are being done is going to be PYQs. Okay, third thing is those lazy examiners who don't want to frame new questions will just want to copy paste previous type of question with slight modification, so those will become PYQs. Okay, so I was actually answering like how to know that if you're not able to remember, just try to remember things which are frequently asked. Okay, that is the key to crack entrance. Okay, so I have already told I'm not going to answer questions on like I have got this score, so will I be able to crack? I'm skipping those questions. Okay, so Navya asks, sir, this 10 days to get more than 140, should I complete my incomplete subjects or revise strong ones? So I would suggest complete your incomplete subjects, because incomplete subject important topics is more important than revising your strong subject less important topics. Yashweza sir, videos or notes? And Avik Das is also asked the same question. Last 40 days, no videos, notes, because videos take long time to complete. Ranjana asks, sir, if recent NEET and AIMS tags in custom medals are done, which tags to focus? It's one is clinical, tag of clinical. Second is problems for physiology, pharmacology and pathology. Third is slides for pathology. Fourth is images for dermat, ortho, and radio. Okay. Fifth is problems for biostatistics. Yashu sir, can we take modafinil? No, not at all, because it will have rebound effect on you. Okay, it will have rebound effect. Not at all. Rangaraj sir, I don't give them ideas about making questions from. Don't give them. Okay. I don't think they are intelligent enough also to make frame new questions. Like NBMS has admitted in court that they can't release question papers because they don't have questions to make. So all those are bullshit. Okay, these people are very lazy. So one is that thing. Second is they want to ask questions from whatever they are doing. Okay, do you think examiners will are bothered about how much well you are preparing or how much hard you are working? Not at all. They're not regarding. It is just like some other question paper that is given to them. Like it is just one more part of their routine which they are not at all bothered about. They'll be like, okay, this government has given me this one, this board has given me this one, so I need to prepare some questions, and they'll just throw those question papers on the face of NBMS and AIMS this one exam section, and then they'll be like, okay. So who is bothered? They are not at all bothered about what questions they are making. Okay, so that's why the questions have so much ambiguity. If they had little concern about students, no? If they had little concern about the work that they are doing, then there wouldn't have been so much ambiguity in the questions that they frame. There is so much ambiguity in many of the questions. There can be two options correct. There can be some the question can be wrong also. Okay, these people are least bothered about that. Pradnesh sir, after INI, how many reads should we complete? Two reads, one in 30 days, the other is in 10. Sorry, after INI CT, 20 and 10 days. Okay. No GTs in last phase. Only you can give is NEET mock. BTS Army has us 110 to 150 in 40. I have already told I'll release a video on that. Okay, Nikita sir, I'm confused. How should I approach PYQs? Like I'm doing it paper wise. Okay, but no, do it subject wise. That is the best thing. Last 4 years, do it subject wise. If you do paper wise, you will lose track of things. Okay, so do it subject wise. Okay, Selva. Give strategy for MD pediatrics exam. I'll give strategy after I pass MD pediatrics exam. Mansi sir, how to deal with variation in GT scores from different platform? I'm getting around 140 and 160. Nothing. If you're getting 140 in some, 160 in some, you'll land up somewhere around 160 in your NEET PG. Okay. So if it is a moderate difficult exam, so nothing to worry. Girish sir, not done good notes. Can I read PYQs and the explanation? Yes, definitely for this last 10 days you can do that. Okay. So it's been 1 hour and 10 minutes longer than we expected. So I'm not going to take any more questions. If you have any doubts, you can contact me at my email ID, babydocrmd@gmail.com, or you can contact me over Instagram, but I'll be less active on Instagram. You can contact me via Telegram also. There is separate Telegram group, which link is provided in the YouTube description of the channel. Okay. So it was a lovely session with you all. So what I realized from this is the main thing that is lacking is confidence. That is the number one problem that is there in everyone. It is not about your preparation. You guys are well prepared. Okay. So from whatever I'm seeing, that in last 1 month you are having 145 correct, 110 correct, 120 correct, or maybe 145, 160 correct. The main problem is you're not psychologically prepared to face the exam. Okay, that is one thing that you need to develop. Okay, so be mentally strong. Just have a positive mindset. Okay, follow a correct routine in this last 1 month. Give all your best. Okay, don't worry about GT scores, don't worry about whatever ranks you're going to get. If you follow everything according to the book, if according to strategies that are provided, and if you don't panic at the last moment, if you're not anxious, definitely you're going to get a very good rank, and you'll definitely get a very good seat. Okay, so all the best for your upcoming INICET. Also, after INICET, let me know how well you have performed and how well you have done in your exams, and then don't take a break because you have NEET PG upcoming, and for that I'll be preparing a separate revision strategy as promised in the last 1 month, how to study for NEET PG. Okay, till then, all the best.